Welcome to This Week in Health IT. It's Tuesday Newsday, where we take a look at the news which will impact health IT. Today we're going to take a look at, the financials of healthcare real quick because it's important. And then we're going to take a look at what 6 CIOs said were their top priorities and key advice during COVID-19. These are 6 CIOs that we did not talk to on the show, so I thought I'd take a look at what they were saying online in the news. My name is Bill Russell, Healthcare CIO, coach, creator of This Week in Health IT, a set of podcasts, videos, and collaboration events dedicated to developing the next generation of health leaders. Are you ready for this? We are going to do something a little different next week for this show. We are going to go live at noon Eastern, 9 a.m. Pacific. We will be live on our YouTube channel with myself, Drex DeFord, Sue Shade, and David Muntz with Starbridge Advisors to discuss the new normal for health IT with you supplying the questions with a live chat during the whole thing. I'm so excited to do this, and I hope you will join us. Mark your calendar, noon Eastern, 9 a.m. Pacific time on April 28th. We're going to do our Newsday show live. There you go. This episode and every episode since we started the COVID-19 series has been sponsored by Sirius Healthcare. They reached out to me and to see how we might partner during this time, and that is how we've been able to support producing so many daily shows over the last couple of weeks. Special thanks to Sirius for supporting the show's efforts during the crisis. It's Tuesday Newsday, and here's what we have in terms of news. We have a couple stories. AHIP COVID-19 study could cost healthcare $556 billion over 2 years. Intersecting U.S. epidemics, COVID-19, and lack of health insurance. Fewer erupts, billions going to hospitals based on Medicare billings, not COVID-19. These are 3 stories. And then the last one I already discussed that we're going to take a look at is Beckers' story, which has some quotes from some different CIOs. I want to take a look at those. So, American Health Insurance Plans, AHIP, released a study that COVID-19 could cost healthcare $556 billion over 2 years. And let me read some of this for you. To get a more complete picture of what COVID-19 costs could be, AHIP retained Wakely Consulting Group to explore the potential cost implications of COVID-19 testing and treatment to U.S. health insurance providers for 2020 and 2021. Wakely estimated that the cost to the healthcare systems for COVID-19 could range from $56 billion to $556 billion over the next 2 years. So I love I love when they do that with the headline. It could cost $556 billion. Of course, the range they give is 56 to 556, which is a wildly huge range, by the way. And it shows some of the challenges with doing these studies right in the midst of the crisis. The risk and impact of COVID-19 are unprecedented, and we are learning more about its true impacts every day. Actual outcomes will differ depending on the things like number of Americans who become infected but are asymptomatic, the impact of interventions such as social distancing, and the availability of testing. Hospital costs could exceed Wakely's estimates if average intensive care stays are longer, more expensive, or require more services than estimated in these models. In other words, I'm highlighting this because it is a very real thing. There will be significant costs, but I'm reading this study. This is having been a consultant for many years. I'm reading this and sort of giggling because it's the quintessential. You asked me to do a study, I did a study, but hey, the range is really broad, and it could be even broader if some things change. So. But Wakely's findings are based on the data and information available on March 28th, which gives you an indication of why they're struggling. As we know, the numbers have been changing pretty dramatically through the course of this pandemic. As the COVID-19 national emergency continues to evolve, AHIP and Wakely will revisit these findings and provide updates as needed. The report considers the impact of COVID-19 to commercial Medicare Advantage and Medicaid managed care plans, assuming a 20% infection rate among the study population. The report estimates that more than 50 million Americans will become infected, with at least 5.5 million requiring hospitalization, of which 1.3 million will require intensive care. For each person admitted into intensive care, costs on average could exceed $30,000. Please see the full report, and they have a link to the full report. They also go on to talk about out-of-pocket costs. So what about out-of-pocket costs? The report also considers the potential out-of-pocket costs consumers could experience for COVID-19 care. Wakely estimates enrollee cost sharing would, on average, be approximately 14 to 18% of annual allowed costs on average across lines of business models, and would range from $10 billion to $78 billion. This figure does not take into account announcements made by health insurance providers that they are waiving out-of-pocket costs for COVID-19, which is a pretty significant number of them that have waived those costs, by the way. So be interesting to see how that comes out. So that's the first of a financial picture that I'm trying to paint here. So here's the next one. Intersecting U.S. epidemics, COVID-19 and lack of health insurance from the Annals of Internal Medicine, April 7th article. A report published in the Annals of Internal Medicine estimates that more than 7 million Americans could lose their employer-sponsored health insurance during the COVID-19 pandemic. More than 1.5 million Americans have already lost their health insurance, and 5.7 million are projected to lose their coverage by the end of June. All right, so that's the second thing, right? So we have significant costs to the health systems. We have a whole bunch of Americans getting closer to 20% unemployment that are going to be without health insurance, employer-sponsored health insurance. And finally, for those who are saying, well, the government is going to throw money at health systems because they couldn't possibly not support them during this time. And they did, right? So there was $30 billion in the original CARES Act. And here's what happened. Fear erupts, billions going to hospitals based on Medicare billings, not COVID-19. So they quote an executive. Well, they have this whole thing about an executive in Florida. And it says executives at beleaguered systems are blasting the government's decision to take a one-size-fits-all approach to distributing the first $30 billion in emergency grants. HHS confirmed Friday that it would give hospitals and doctors money according to their historical share of revenue from Medicare programs for seniors, not according to their coronavirus burden. This method is woefully insufficient to address the financial challenges facing hospitals at this time, especially those located in hotspot areas such as New York City region. Kenneth Rasky, CEO of the Greater New York Hospital Association, said in a memo to association members. States such as Minnesota, Nebraska, Montana, which the pandemic has touched relatively lightly, are getting more than $300,000 per reported COVID-19 case in the $30 billion, according to the Kaiser Health News. On the other hand, New York, the worst hit state, would receive only about $12,000 per case. Florida is getting $132,000 per case. Kaiser Health News relied on the state breakdown provided to the House Ways and Means Committee by HHS, along with the COVID-19 cases tabulated by the New York Times. All right, so a lot of stuff on financials. Why am I talking about financials? This is called This Week in Health IT. Well, you know what? The reality is the financial picture has changed for every health system. Now more than ever, it is important for CIOs and other IT leaders to understand the impact and start to consider the ramifications. We've just been asked to summit this huge mountain, and in response to the coronavirus, right? So we stood up telehealth, we stood up work from home. We've done a lot of just amazing things, and we should stop at the top of that mountain, put our arms around each other, take it 6 feet apart, take some pictures, and enjoy the view. But we're going to have to come down from that summit, and that's what I've started to talk about starting last week. And we need to try to figure out the new normal for each health system, right? So we're going to be returning, if I use that mountain analogy, we started from a base camp, we went to the top of the mountain, but we're going to be returning to a different base camp than the one we started out on. And it's trying to figure out what the new normal is for your health system. What base camp are you going to be returning to? Most health systems will be, they're generally conservative organizations coming out of this, but there are going to be others that are going to have the opportunity to be aggressive, right? It is widely considered to be truth that large health systems will weather this storm better than smaller health systems. And I'm not sure that's really true. Large health systems have more resources. That is absolutely true. And some smaller systems don't have enough resources, and they're going to really struggle. But large systems also have more liabilities. And the operative word there is the word more. They are bigger and less nimble. I was with a company that went through Chapter 11, and one of the mantras I got really tired of hearing coming out of this was cash is king. Well, in coming out of this, access to capital is going to be the king coming out of this crisis. Strong business leaders will understand that this crisis opened up a rare opportunity in the market. You get to place bets coming out of this if you have the capital to do it. And while a bunch of emphasis over the past couple of years has been on internal efficiency, I believe that M&A activity and consolidation is going to be the new order of the day coming out of this. So what is the message to health IT? Strategies come from the business. The business environment changed dramatically. Understand the business environment and its impact on your health IT strategy. We're coming down to a different base camp. Start to evaluate how your system is thinking about the new norm and the new environment that we are walking into. So just something to consider as we come out of this. All right. So, not everybody came on this show per se. Some of them actually didn't have time, and so what they did is they responded to some emails. A lot of these articles that get written, as a CIO, I used to receive some of these requests. They'd say, "Hey, we're going to do an article. Can you answer these 3 questions?" And it's a lot easier to sit down at your desk and just answer these 3 questions, and you send them back, and voila, you have an article. And I think that's the case here. I'd be surprised if it wasn't the case here. This is a Beckers story, and it's called "The Difference Makers During This Surge: 6 CIOs on Top Priorities and Key Advice Amid COVID-19. So a couple of people are quoted here. None of them have been on the show. No. Let's see. No, actually, 2 of them have been on the show, but not during the COVID crisis. PJ Moore has been on the show, CIO of Providence, and Tom Barnett, CIO for University of Rochester Medical Center, has been on the show. So I'm going to touch on some of these. I think they did a good job answering these questions. So 3 top priorities during COVID-19. Enhancing, so this is Jeffrey Sturman, CIO for Memorial Healthcare System in Hollywood, Florida. Top 3 priorities: enhancing and rapidly pushing out our existing telehealth capabilities. We've heard that over and over again, and that is true. Helping to coordinate consistent and constant communication with our patients and consumers via any and all technology means. That includes websites, texts, emails, bots, telephone, and even manually, while also helping the facility's communication to our internal healthcare staff through video conferencing and all other traditional means. I love that. I think that has a lot of great insight in that early on we were sort of looking at this, but I was hitting websites early on that were way behind the curve. I mean, we should have had things on our website early on. We should have been redesigning them. This is going to be something to consider as we come out of this, is do we have the ties between marketing and IT and even some clinical information? Do we have all those ties together so that we can produce the websites and the texts and emails that are going to go out and stand up the bots that we need? A great observation by Jeffrey Sturman there. And then he had designing automated screening, scheduling, and results notification process for our local, regional, and state representatives in testing of COVID-19. The thing I hope comes out of this, by the way, is we just stood up these things for COVID-19 that we have struggled to stand up for, a decade. Quite frankly, getting those test results back in a timely fashion to our patients. This should be something that we had done a long time ago. So those are 3 of his top priorities. His key advice: we need to all remain extremely flexible in these uncertain times, and we are used to running projects across our diverse settings. Our IT teams are oftentimes helpful in coordinating and facilitating major initiatives, and we are certainly in the midst of major activities in dealing with COVID-19, and IT can help to keep things controlled. Finally, we are all in this together. The thing I like about these statements, the key advice statements, is it talks about the integration of IT. If your IT team is tightly integrated with the other parts of the organization, with marketing, with the leadership team, with the clinical side, we're generally tied in pretty well with the clinical side because we're doing so many EHR projects, but we need to be tied in with all aspects of the business, and he really highlights this. Let's skip that one. BJ Moore. We are starting to see BJ Moore, Vice President, EVP, CIO of Providence. We're starting to see the benefits of our progress that we have made, standardizing our systems and tools, moving to the cloud, and simplifying the environment. Having most locations on the same instance of Epic, for example, has been critical in helping us drive rapid response to changing needs. Having Office 365 and Teams rolled out, the majority of our caregivers have also made a big difference in our ability to maintain productivity. This, together with improvements in network capacity and VPN, are allowing us to enable work from home for a broad range of clinical users. I thought it was interesting. A couple of the CIOs came on and did talk about the fact that even though they may not have predicted the level of bandwidth they needed, the carriers really stepped up in this case. It was a phone call or two, expedited contracts, and things were turned up in days that would normally take weeks or even months. And kudos to the carriers out there who recognized the situation that we were in. They prioritized the bandwidth to the health systems during the crisis. BJ really focuses in. If you spend any time with him, he's a big platforms guy, cloud platforms, platform tools as well. Office 365, Teams. We've seen Teams used pretty effectively in this crisis as well, and not only for managing projects and managing your work from home teams, but also we've seen it for clinical rounding and some other things. People are being really creative with this. I think Teams is going to be one of the big winners out of this. I think Microsoft is going to be one of the big winners out of this. If there are winners, I mean, clearly this is a pandemic. There are people dying and those kind of things. But I think we are going to have new learnings out of this. We're going to be stronger out of this. And one of the things is that we are experimenting and learning how to use some of the tools that we've had in our arsenal for years. And we recognize the need for that in the crisis. And sometimes you only recognize it in a crisis and bring it to bear. So some great stuff from BJ. His key advice: important to have strong leaders engaged across the board, driving very intense coordination. In this kind of situation, it is very easy to have many well-intentioned efforts at odds with each other, which can result in a waste of time and resources. It's important to have well-functioning command and control structures to manage the response. Also, having to enable business processes and roles that are traditionally performed at the office setting versus home has provided valuable insights for our device strategies. For example, using laptops instead of desktops, so forth. Again, great insights. Appreciate BJ talking about those things. Lacey Williams Carlson, CIO, Bon Secours Mercy Health out of Cincinnati. Our top 3 priorities to support clinical operations include rapid changes to our Epic instances to build COVID-19 dashboards, and we've talked a fair amount about that on the show. And a lot of great work has been done there. Build build COVID-19 dashboards and registries, build and configure repurposed inpatient care units, and support changes in accessing records. Number 2, deployment of technology supporting new approaches to care, such as workstations on wheels located for isolation rooms, and rapid expansion of virtual visits. I'm not going to touch on virtual visits. We've touched on that a couple of times, but the organizations that have a single instance of the EHR, regardless of what that is, I'm not a proponent of one versus another, but if you have a single instance of your EHR across your health system, I think you had a huge advantage going into this crisis. And I think it's going to be one of the things that gets evaluated. If you're a system that is trying to do a multi-EHR strategy, and you had not progressed far enough along in terms of your ability to have those integrated and the data sharing, the ability to do screens across multiple things, across multiple instances, I think you recognize the significant weakness of that strategy. You either need to shore up your ability to do that, or you need to adopt a single EHR strategy across the board. And then the other thing I think we saw is creative uses of technology. We saw cameras taking temperatures of people. We saw iPads in rooms. We limited the number of times that people had exposure to COVID patients. A lot of really cool thoughts on that. So Lacey's key advice: the biggest need for technology resources and budget to support caregivers is additional mobile devices and new configurations to support constant innovation and new use cases. The partnership of clinical informatics and IT has never been more essential to assure we meet caregivers' needs. I would like to commend many of our vendors who have stepped up to say, what do you need, and have partnered with us to get the equipment and assist us in building out solutions. Zafar, Chaudhry, Doctor, Senior Vice President, CIO, Seattle Children's. My priorities include maintaining a stable and resilient remote working platform technology, the mental health of my employees, keeping clinicians, clinical services supported so they can continue to take care of patients, and pivoting. Key advice: COVID-19 is going to have a long-term effect on how healthcare organizations look at their costs, how they shift delivery of care away from the medical centers, and how they pivot to virtual moving forward. Healthcare systems must reevaluate all aspects of how they deliver care and make sustainable plans to put cost improvement programs into place throughout all clinical and non-clinical areas. Healthcare systems should plan to reduce back office costs, including IT, human resources, and revenue cycle also. I think it's interesting. That's one of the reasons I focus on those three financial stories. I think Dr. Chaudhry appropriately points out that the new norm is going to be one where we put a renewed emphasis on efficiency, a renewed emphasis on interoperability, a renewed emphasis on financial management, and cost reductions, I think, are going to be par for the course. And then Tom Barnett, University of Rochester Medical Center. Our top priorities tended to shift very quickly once COVID-19 took center stage. As a result, the team shifted priorities to those that immediately supported the health system, including scaling up our ability to support work from home scenarios, expanding telemedicine, provide connected with their patients, and focusing on our expenses, both operating and capital, to assist the organization through this challenging time. I'm extremely proud of how great IT leadership team, our great IT leadership team, that is staying synchronized with our operational leadership. The other thing I will point out, just from doing so many of these shows over the last 30 years, I think we've done 35, 36 of these shows and talking to different CIOs. It's amazing the things we've been able to stand up in the last 60 days in terms of communication. We've created this cadence, this rhythm of communication that I don't think we had, or at least we didn't have it as often. And a lot of times we ended up with miscommunication or gaps in our communication because we didn't have that stood up. And it'll be interesting to see if we can maintain those communication rhythms, those communication cycles, or the cadence of communication, and the clarity that has come out of this. Now, I realize part of the clarity is because of the focus on COVID-19, but perhaps from this we will have experienced what focus feels like for the health system, and we can take it forward with us. So I wanted to touch on that story. Some great wisdom, some great insights from those leaders. That's all for this week. Special thanks to our sponsors: VMware, Starbridge Advisors, Galen Healthcare, HealthLyrics, ProTalent Advisors, and Sirius Healthcare for choosing to invest in developing the next generation of health leaders. This show is a production of This Week in Health IT. For more great content, check out our website, thisweekhealth.com, or our YouTube channel as well. If you want to support the show, the best way to do that is share with a peer. Send an email or let them know, however you do it, that you get value out of this show, and that will really help significantly. We're going to be back again for more episodes the entire remainder of this week, and don't forget, live next week. In fact, I didn't give you the URL. It's thisweekinhealthit.com/live. That's right, it's that simple. Or thisweekhealth.com/live. They both go to the same place. Thanks for listening. That's all for now.